Well, there's probably more where that's coming from, unfortunately. Hey, Dr. Malone.
April the 16th is Thursday. We're into our fifth week off campus here, doing remote work. We actually did a doctor's deposition this morning via Zoom, and then we had a couple new client meetings today via Zoom. So busy day at the office. Everybody's out in their respective houses, I guess, their home offices, doing their work from their various places. And I'm not sure how productive everybody is, but they are there and they are healthy. So I guess in some respects, we've been successful in keeping people from having the virus. Part of me wants to say, who has the virus? Let's start there and then work our way. Maybe if you have the virus and you're watching this, maybe you could tell us, even under a fictional name or fictitious name, where you're located, generally speaking, or what neighborhood you live in. I'm just curious to know, who are these people that have it? Where did they get it? How did they get it? Did they travel a lot? Did they come in contact with somebody that was traveling a lot? What is going on here? It just seems like we don't have enough information. I'm in one of those moods today where I'm like questioning everything. I'm like, what is going on? Why don't we have more information? Why don't we have more information about this? Why are we having to guess? This morning, I'm listening to the CEO of Verizon talk about how he wanted to
certain stores, blah, blah, blah. And he was talking about how certain businesses they're just going to create their own test and pay for their own test and test their own people. I'm like, this just sounds like third world to me. Like, what country are we living in? Like, why aren't we doing this stuff? What is happening? I think when Trump was talking about how people were going to be able to go through Walmart and get a test, and at the beginning of this, that sounded like the America that I was hoping that we'd be living in. Like, we'd have our shit together ASAP, and by the next week, we'd be running through Walmart getting tests, and there'd be 25, 30 million tests that were been done by now. And there's like 3 million tests, and you got to jump through 38 hoops before you get one of those. So it's a little crazy. Anyway, what's can you see what's going on with that, please? What's new locally, Dr. Malone, from a medical standpoint? I'm done with my soapbox.
Okay, that's fine. So locally, I know yesterday we were talking about long-term care facilities having 49 linked cases to the facilities. And we went through that whole exercise. Well, it wasn't an hour after we got off video, and I was doing some more reading, and it turns out that of the 4 deaths in Escambia County at this point, three of them were from that pool of the long-term care facilities. So it kind of falls in line with what we already knew as far as risk factors of age and comorbid illness.
But of course, also, did they tell us what facility it was in?
The deaths, no. But what I was going to say is, this is why that's scary. So when you see a rapid blossoming in these long-term care facilities, to know that as a county, we have 277 cases, and there's 1 death out of those 277 that's not in a long-term care facility, and then there's 3 out of 49 that are dead. That's it's pretty morbid. And so
right.
that's why you hear about, back when we talked like 2 weeks ago, Washington State, the first nursing home over there in Seattle, that it had 40 people died very quickly, and then they had the same thing just outside Richmond, Virginia last week.
Well,
and,
let's just cut to the chase. It's big business, and nursing. The one in Washington State was one of the largest franchise assisted living facilities in the country. I think I read in an article a couple of days ago that they made they had $3 billion in gross revenues. And so look, this is big business. These people are not going to they don't want to disclose that they got people dying in their facility because it's bad PR for them. I mean, it's that simple. It's that simple. I mean, unless somebody makes them do it, which the government's evidently not going to make them do it at this point, they're not going to do it. What do you think? They'll be good citizens of the area? Hell no, they're not going to do that. It costs them money to do that. Why would they do that? I wouldn't have a job. I would have a job if people were good citizens, right? I would not be employed. Trial lawyers would not exist because everybody would do the right thing, the responsible thing. They're not going to do that. So somebody forces them to do it. So anyway, what else did you learn about?
So then,
educate us
so this isn't necessarily a specific number or even specific to here, but it's something that I think we need to be aware of is on the whole, the population that's presenting to the hospitals now because of this virus. They're the people that tend to be much more sick now because these people that are testing positive, they're not going to the hospital if they can manage it, and they're trying to manage it from home. They're trying to, isolate and do the right thing. So the people that are showing to the hospital are sick. So at the outset of this, it was 20% of people, 10 to 20% of people that presented to the hospital with the virus were ending up in the ICU. Well, now that percentage that show up to the hospital that end up in the ICU is actually much larger, but it's because the presenting pool is different now. So you're having sicker people show up. So now if you see or hear, oh my gosh, 90% of these people that are coming to the ER get into the ICU, that's a numbers game. So don't fall for that, and just understand that the healthier people, the people that are tolerating the illness, are staying home. And so they're the 80% that weren't getting in the ICU anyhow, so they're not even going to the hospital. So expect that you see the percentage admitted to ICUs to go up based on the hospital presentation. So I just want to let people know that in case you start seeing some of those numbers, because it's scary when you first see it. Other local stuff. I looked everywhere.
Can I add something that dovetails into that? Yesterday we were talking about how many people from that ship, aircraft carrier, were asymptomatic carriers of the virus, and how most of them were asymptomatic carriers. And then I saw another study, and I can't remember where it was, where they, pregnant people have to go to the hospital no matter, most of the time, no matter what. So whatever's going on, they still got to go. And the same number of pregnant people generally are going to the hospital having babies. Well, they're giving all the women that show up at the hospital for childbirth, they're giving them tests for COVID, which again is sort of a random kind of cross section of people that really don't have a connection with each other. Same thing with them. Most of them that tested positive were asymptomatic. So there's two separate groups of people that are both, I think, comparable and analogous to at least some subsect of society. Diverse backgrounds for the most part. The people on the ship may not be exactly diverse when it comes to body fat and health and age, but they certainly have different backgrounds. The pregnancy group was just a random sampling of people that came in for childbirth, and those two were carriers without symptoms. So again, the concern being, if you got all these people and most of them are carriers without symptoms, and you start putting them all back into an office space or any kind of a tight spot, they're just going to spread the virus. And unless you're one of those people that's going to be a carrier without symptoms, you're going to end up getting the virus. So sorry, just wanted to put that.
No, that's fine. Yeah. No, it's important just looking at the trends, and I mean, it's reassuring as much as it's scary, like we talked about last night. Reassuring because it's good to know that these people are tolerating the virus, but it's bad to know that they're tolerating it and spreading it.
Right.
So anyhow, just to finish off the local numbers, the long-term care facility numbers locally are up to 52 now. So we were 49 yesterday. So 52 associated diagnoses of positive there. So again, of those 52, 3 have died.
I don't know why we should even believe that, to be honest with you.
Yeah.
Why
So-
should we believe that?
I don't. I have no reason to
There's
believe or not
nursing
believe.
homes. There's nursing homes in whatever that was, New Jersey. They were putting bodies into a storeroom or something, like 17 of them, right?
Mhm.
I get, whatever. Just whatever the state lets them get away with, they're going to get away with it. So,
Yep.
Go ahead. Sorry.
So, all right. So headlines today, I try to focus on what's making news or what's about to make news, and try to lend some insight or context to it. So over the last 24 hours, the big thing that we start seeing is, hey, this virus it came from a lab. Okay, and so that's what people see. That's what they hear. So I'm not going to bore you with this whole here, but it's a fantastic paper. It's going to be linked today. And
Wow.
the synopsis is this. The synopsis is this: these are microbiologists who do this stuff for a living, and I'll put up their other thing that they had on here. They do this stuff for a living. I don't have the other one, so I'll just put that back up. They do this stuff for a living, and they study the DNA, the genetic material of viruses day in and day out. They're insanely smart. There's a very good YouTube video where he explains the whole thing, and again, we're linking that today. I encourage you to watch it. But basically, they're saying that this thing was not created in a lab. Okay, it may have generated from a lab, but everything they found out is that the structure of this virus, if someone designed this, they designed it not as smart as they could have, because the receptors that the little corona, the spikes bind to, it's not the ideal one. In fact, it kind of works. It could work a lot better if someone really knew what they were doing, if they want to design it. The other thing is, they have like a whole index of the skeleton of these viruses, and basically no one swapped this thing out and made it a different kind of a different model. No one upgraded this model from an old virus. So they have every reason to believe that this thing mutated and then infected, or it infected someone and then mutated within the population until it was able to infect more aggressively. So it's a fantastic paper. I encourage people to watch it. But again, this was not created in a lab. It may have generated out of a lab. That's the takeaway there. So everything you're seeing on the news, don't think that this is some sci-fi movie and someone's like splicing things together and making Godzilla or something like that.
And those scientists are not based in China.
No, no, they're in the States. Let me see. I'll scroll down on my end here. It's this gentleman, Christian Anderson, and he's out in La Jolla, California, at the Scripps Research Institute, and he's got a whole team. And again, we're linking their site there, not because I'm promoting them, but because I really think it's a consumable, enjoyable video for someone who, don't watch Netflix for a day. Watch this. It's a great hour to spend if you have the time. So I recommend that. And he goes through more than just the real the microbiology part of it. He goes through the population impact of it all and how to control a pandemic. He's got a really good take on it, and he even gets to the point of the stuff that.
Why can't he come up with a vaccine and he knows so much about how it was structured and built and what its weaknesses are? It seems like he's the perfect guy to be saying, okay, how can we kill this thing?
Well, and that's talked about in there, and I guess he's very transparent, and so much so that he's not a virologist, he's not a pharmaceutical engineer, but he could work in concert with some of those folks to try and come up with something. So he shows where the weaknesses are, and one of them is the binding site. So this coronavirus, the little spikes, the corona that are sitting behind me here.
They're right behind you.
Here. Yeah, they're right there. The receptor those things attached to is called the ACE2 receptor, and that's what you heard of in the news about these ACE inhibitors initially. So the ACE2 receptors are in our lungs primarily. And so this thing attaches to the ACE2 inhibitors, but not real great. And so the idea is to try and block these receptors, which is where the genetic material gets injected into our human cells when that corona attaches to the receptor. And so they've exposed some of the weaknesses there, at least on the microscopic level, to say, how do we block this now? And yeah, if you have an antibody, anybody's going to block it. But if you have drugs that can block that, or drugs that can basically kill off that receptor without causing any harm to the human body, then maybe that's the route to take. So he provides some
Okay.
good insight. So, that leads to the next thing, because he also talks about managing the outbreak. And yeah, there's lockdown, and I think I said like a week or two ago, is doctor, the easiest thing to do is intubate someone. That's a no-brainer. Okay, the hardest thing to do is get them off the ventilator. Well, apply the same logic to locking down an economy. It's seemingly relatively easy to lock something down, but to unlock it, it can be disastrous. So I mentioned this last night with the staggered opening, and this isn't really medical so much as it's just management of how we're going to get through this. And President Trump's on TV right now, and I guess the headlines I saw is that they're going to do like a phased opening, and kind of defer to some of these. Let's see here. Nope, that's the wrong one. Apologies. Let's see here. So with the staggered opening, let me try and find the right one. I think it's this one here. Yeah. So I won't bore you with the whole thing, but they basically say, and this is just a proposal that someone really modeled and said that if it's staggered the right way, they could save 1 to 2 million lives worldwide. And it's basically having a throttle in place on a county level and a state level and a country level, where you are monitoring the needs of your local community as far as like ventilators, for instance. So if the ventilator needs aren't there and people aren't getting sick, then you can open things up to the point of, hey, we can have elective surgeries now. We can have commerce. And then maybe like 2 counties over, they're not for whatever reason, because their ventilator demand is still there. So he gives a pretty good projection about how to do this. And he gives a couple of different models, and he talks about, and I'll zoom in here, basically leaving counties locked down for a long time is a catastrophe. Goes on and on and on. Using certain days of the week, which is one way that he proposes that this be done, and it's been done in other locales. And then he also talks about how this could be, if we don't manage it appropriately, we could have another outbreak later on this year, which you and I referenced multiple times, and it could force like lockdown again till the end of 2021. So
Well,
I think
Pensacola has already come out of lockdown. I don't know if you've noticed it because you've been at home, but
yep.
over the last several days, I can tell you this: the traffic on the bridges is just like a regular day. Minus the school traffic, there's no difference. The foot traffic downtown is getting back to normal. So I'm not sure that a phase-in is going to work, because people are going to hear that and say, oh, well, we're done. And they're going to come out. I think in towns like this town, where you don't know anybody that has died from this, you don't know anybody that's even sick from this, you're going to think this is not something that affects me, and you're just going to let loose. Okay.
Mm-hmm.
And they're already having protests in some towns. Detroit had protests from the areas surrounding Detroit, not in Detroit. People came in from the more rural areas.
The suburbs.
Yes. And they were protesting the lockdown. I got a simple way to handle that. Everybody that doesn't want to be locked down, don't be locked down, but we need you to sign this thing that says, if you get sick, we're not going to bust our ass to save your life. We're not going to use the last ventilator on you. We're going to let you handle it on your own, and just let them do it. Have at it.
Yeah.
Okay. If you think you're invincible, then go be invincible. Okay. And if I'm wrong and you don't get sick, well, guess what? You didn't get sick. That's a good thing. So that's not bad. Okay. But I don't feel like any of this is smart unless we have testing. And I don't understand what the big deal is. We should be focused. Everything in this country should be focused on getting some kind of widespread testing procedure and contact tracing. Those 2 things need to happen. And I don't understand why we're not doing that.
Well, and part of like these models is to, you manage the illness with the testing and with the treatments when they become available, and then with the end goal being herd immunity. But we talked about that last night. That's a long ways off. So I guess the salient sentence in here that I saw is right here: if the U.S., whose trajectory is somewhat ahead of the world, the projected rebound of a late year unlock is already greater than the current crisis is projected to be. So
Okay.
it would be
Well,
a more painful peak. So that's kind of, and so I shared that. Again, it's a very rudimentary suggestion about how to go about doing this, and it looks like some of those ideas are being implemented. At least I know locally at Gulf Shores, there was news that was shared today through Michelle, actually, who sent that over from the office, and that the Gulf Shores community is basically a partial reopening over there. And it's even like,
what are they opening over there?
It's like they're starting it started. They're allowing some restaurants to operate. They're allowing
Oh, that's
people
really
on the beach.
smart.
So there's people on the beach, but they're
Yeah,
not
I'm not
coming
gonna
in,
look.
but then they're
I'm not gonna look to Alabama to figure out what I'm gonna do with anything. So
okay.
bless them over there, right? But they got some
Okay.
ways of doing things. All right.
So
I'm from Alabama. I can talk that way. So you can trash me all you want, but I was born and raised there. So anyway, now let's talk about what else you got. This scientific.
so last thing that's scientific here today, and I kind of put it up there prematurely, but so we talked about this a few days ago at the outset, the blood type stuff, right? Like
Yeah, we did.
more at risk. And so that was all based on a very rudimentary Chinese study. They released it without any peer review. They were very open about that, saying, hey, someone's got to study this some more. And so this paper here talks about that. And if you let me swing over to the conclusion, basically found that, it basically found the same finding. I'm having trouble getting to the conclusion. So here you go.
The results.
Oh yeah, no, there's conclusion here, and it is that the results are very similar to what the Chinese study showed, actually, where there is an increased risk for A types to be positive, decreased likelihood of O types to be positive, so which is what the Chinese study had shown. So if you're A type, there's a greater likelihood that you could contract this disease. If you're an O type, you are, I guess, somewhat protected naturally. And then they found additionally that the B type also had a little bit of an increased risk. None of this is anything new, but it's applied on a US model. So I guess I take a little bit more credence in this, and they have reviewed it. So it kind of goes along that it wasn't just hocus pocus coming out of the initial study. And now again, same thing though. How to apply this? Is there more genetic? Because they assume that with this it means there's some genetic component to susceptibility to it, and then could there be genetic components to your response to the infection? That cytokine storm we talked about a week ago. So this is a stepping stone, more or less. It's not a final answer. It says, hey, we got to keep going. So these folks are pushing forward, and it's not necessarily going to change this pandemic, but it changes the way viruses are managed in the future. So the next time there's some virus people are worried about, they say, hey man, we know how to crack this code if it somehow involves blood types and genetic predisposition. So I think for the greater is a long range application, not a application for next week or next month or even this year. So I just wanted to follow up on that, since there was some questions that came up from that when we initially presented that. So that's your follow up on it. So that's what I have as far as science.
All right. So I have a feeling that by this time next week, we're going to be pushing the end of April, and unless things take a turn for the worse, my suspicion is, regardless of where we are with testing and the contact tracing, regardless of where that is, there's going to be some artificial deadline of May 1st that everybody's just going to jump on, and the politicians are going to jump on it, and it's just going to happen. And so I think we should be talking about how best to protect yourself in an environment where there's a lot more people now disregarding the social distancing stuff, okay? And how best to survive, and where to find a test. Because as soon as somebody is able to figure that out, like I think all the Walmarts, like the White House was originally suggesting. They said something about parking lots at Walmart, parking lots at Walgreens. That sounded like a great idea. Like, what if all the Walmarts had a setup where you could go and get tested and you didn't have to meet 83 requirements first? Well, I'd send everybody to the Walmart before Monday morning and say, all right, folks, you got to go to Walmart and get your test. And then they'll give you a little slip that says you don't have the virus. And when you come Monday morning, we're not only going to take your temperature, we want to see your slip of paper that says you didn't have the virus last night.
Your passport.
Yes. And then Wednesday, we're going to do it again. And we're going to do it again on Friday. And we're going to keep doing that until we've got a vaccine or a treatment for this, because I'm not going to have you spreading the virus in here. And anybody that comes in this office from the outside has got to show me a slip of paper that says they just had a test, or a piece of paper that says they have the antibodies. And I don't even know if that's good enough anymore, to be honest with you. So, okay. That's where we are. I'm frustrated with a lot of things. Look, it's contrary to my best interest financially to not have people riding around. Okay. I am saying things that are against my own financial best interest, but I don't feel like we're in a position to let loose yet. I think we need to have some idea of who all's out there that's asymptomatic and has this virus. Okay. Until I have some sense of that, even if you just did it in one city and said, we're going to do it in one city and we're going to tell every other city there's about, 20% of your population that has it, just FYI. If we even knew that, it would be helpful, right? We don't even know that.
I think that's what they're doing. Like in Iceland, they tested like 10% of their population, which is a much smaller population, but I think that's what they're trying to obtain there.
Well, I'm glad Iceland's going to lead the way on this. Wonderful. That's great. That's great. That's great. So anyway, that's where we are. And I guess we're just going to go with it. And, it's like everything else, just there's certain segments of society that are going to say, screw it, I'm just going to go do whatever I want anyway. And if we open the beaches and we open, have gallery night again, I mean, I guess there'll be some people that participate and some people that won't until this is, safe again. And that's where we are. So, all right, Dr. Malone. Well, we're available for consultation in injury cases. If you have an employer that's forcing you to go back to work on Monday and you don't feel like it's safe, you can let us know. We might be able to help you with that too. I will tell you this, that employees in Florida are employees at will. So unless you have a contract of employment with your employer, and unless the government says you are supposed to be home, they probably have the right to fire you if you don't show up. So that's an unfortunate thing, but we're happy to talk to you about that. We don't do that per se, but we're happy to give you whatever advice we can on that. We do work obviously on all types of injury cases. You can find us on the web at zarzaurlaw.com, 855-HIRE-JOE if you like to call people, which most people don't these days. And you can also ask your questions on YouTube or Facebook or whatever you want, and we'll get back to you. Y'all take care, be safe. We will see you tomorrow. Thank you, Dr. Malone.
Bye now.